Oh, great. It's mine.
We're good? All right. Good evening, everybody. Ooh. Little bit of a feedback. We're good? Awesome. All right. Welcome to the Center for American Progress's Real Progress program and DC Doc's premiere of Life After. My name is Mia Ives Rubley, and I am the Senior Director of the Disability Justice Initiative at CAP. First, I want to thank the CAP's events team and DC Docs Fest for putting this event on. I'd also like to thank all the volunteers who assisted today. Also, I want to thank and welcome Reed Davenport, who is the director and star of Life After documentary. So I'm thrilled to be introducing this film as I research and advocate for progressive disability policies that center disabled people. I got to watch the documentary last night, and I was so impressed at how the director delicately investigated assisted suicide, ableism, and the social safety net system. The film centers around comparing the various lives of disabled people struggling to obtain services and support and feeling trapped with no good solutions. It centers around Elizabeth Bouvier, a disabled woman who had an assisted suicide legal case, and what happened afterwards. This documentary is full of soul, intrigue, and complexity. I hope you stay curious and open to the perspective of each disabled person and family member within this film. Now, I'm going to hand it off over to Dr. Amy Kenny, the director of the Georgetown University's Disability Culture Center. She's a disabled scholar, practitioner, writer, and advocate who published an award-winning book titled My Body Is Not a Prayer Request.
Hi, everyone. Thank you, Mia, and thank you for being here. My name is Amy Kenny, as was said, and I am the director of our Disability Cultural Center at Georgetown University, which is a co-sponsor of this evening. Our DCC is open to all students and celebrates disability through the transformative power of the arts, sciences, and community. And the DCC fosters a culture of access for our students and embraces non-apparent, apparent, and dynamic disabilities as vital to the vibrant diversity of humanity. Let's give it up for that. Yes. On behalf of DC Docs, we're delighted to welcome you to the third edition of this festival. We're especially grateful to the Center for American Progress for this wonderful partnership and home for Life After. DC Docs is made possible through the generous support of many partners, especially our major sponsors, Artemis Rising Foundation, the Ford Foundation, Just Films, the Perspective Fund, Humanities DC, and Voices on Chain. So we hope you enjoy the film, and we're really excited to welcome you to this evening to our screening of Life After.
Thank you. We just watched an important film, and I think for many people in the audience, it may have exposed you to something new, a new idea, a new understanding, a broadened understanding about disability and assisted suicide. And as the credits were running, Reed, you had the list of the many people who helped fund the making of this film and supported you, and among the first that were there, I saw Independent Lens, which is a PBS documentary program, I saw the Corporation for Public Broadcasting, which funds public media, NPR, where I work, and PBS, and independent filmmakers. And it made me think about how yesterday the House of Representatives passed a rescission bill to claw back, to take back 2 years of funding that Congress has already appropriated for public media, $1.1 billion that would largely fund PBS and NPR and films like this. And now it goes to the Senate. The Senate has until mid-July to vote on it, and if they also agree, then the money will end. This public money will end as of October 1st for the next 2 years. And we may be at this documentary film festival next year talking about the crisis in for filmmakers like Reed to find the funding they need to do this kind of filmmaking. So that I was struck by that. Let me introduce the panel. Mia Ives-Rubley is the Senior Director for Disability Justice Initiative at American Progress. Thank you for hosting us. Lisa and Jen Chung Sung is the Director of Public Policy at the National Disability Institute, where they focus on policy to create financial freedom and economic opportunity for people with disabilities. And Reed Davenport, our filmmaker, tells stories about, rich stories about disability, and he's won awards for this new film, Life After, and his earlier documentary, I Didn't See You There, both won awards at the Sundance Film Festival. So Reed, let me start with you.
Hey.
So this film starts with as a look at assisted suicide, to your quest to find Elizabeth Bouvet, to talk to her about her life after 1984. It turns out that smiling woman in the photograph wasn't her. You before this started, you said that I was the one who gave you that picture. I'd never seen that picture before. I don't know where you got it. I don't think you got it from me.
I got it from you, John.
All right. I want you to.
Bob, it's important for the film.
It was, right.
So I don't know why you're shying away from
If
that.
I sent you on that quest, then I'm proud of it.
Thank you.
All right, I'll tell you. Well, I will. I'm glad that you went on that quest, and so. But it's interesting because you look for her, and then you find that that she's not alive, and then this film takes a different direction. It becomes this meditation, this examination of medical bias against people with disabilities, and what that means when we judge people's quality of life and make decisions about who gets health care as a result. So is that how your process in making this film went? That it started as a film about assisted suicide?
Yes and no. I wrote about Bouvet years ago, and I was fascinated by her story. And then equally fascinated that her Wikipedia page didn't have a date of death, nor did the internet have any information about what her life was like after the 80s. And after reading Bouvet, about Bouvet, I kept running into stories that echoed the same questions that Bouvet asked, and kind of echoed the same, I think, fantasies that really kind of gave her story a life. That disabled people do have a low quality of life. And that's instead of providing people with disabilities the means to life, we should focus on ending their lives. So I saw that with Michael Hickson, I saw that with Jericho Morland, I see that in Canada. All these stories are different iterations of Buffet's.
Right. But so when you found out that she was no longer living, what did you think at that point?
It was devastating professionally and personally. And then we quickly realized or reminded ourselves that we weren't really looking for whether she was alive or not. We were looking for what her life was like after the trials and any more insights into her life during the trials. What had the media misreported or had they left out of the story?
Right. Creepy Mike Wallace. And also, can you talk a little bit about, in the disability rights movement, there is this worry, this opposition to assisted suicide, but there's also a belief in bodily autonomy, the control over one's own body, which one could argue would extend to deciding how one dies. So, and you really sort of thought about that. Talk about how you balanced thinking about those two values for disability rights.
Yeah, I value bodily autonomy as much as the next person. And I think what you see in Canada, what you saw with Buffet was she wasn't able to live a life by her own design. So why do we only offer bodily autonomy in death? We should be offering it in life.
Mia, can I ask you, so this film makes us think about healthcare and disability and barriers to healthcare for disabled people. Can you help us understand how these issues are important at this political moment when we're talking about big cuts to the budget, to the social safety net, to Medicaid, maybe Medicare, and this moment that we're talking about cuts in the budget?
Yeah, I think the one thing that I was thinking about while watching this documentary was about sort of the time frame that it was in during COVID, and thinking about how disabled people were treated during the start of the pandemic, and in terms of not receiving care, in terms of prioritizing certain lives over others. And I think, was his name Michael?
Michael Hickson.
Yeah,
Mike Hickson. I remember specifically hearing about that story, and it really just sent like a shiver through my body of knowing that if I got COVID and needed life support, that could be me. And so, I was hopeful that COVID would be a starting place where we could sort of reestablish new policies that would support a lot of different people, including disabled people, and we sort of saw that.
Optimistic.
I know.
That was
I know.
so optimistic.
But we saw an increase in accommodations for everybody in terms of being able to work remotely. We saw people being able to take time off to take care of their kids and their loved ones. But then we saw a huge rollback of that. And then, we had what happened last year. And now we're seeing a sort of re-energization of eugenics, where we are prioritizing certain lives over others, and that's including in the current bill that is being bandied about, which looks at cutting Medicaid, which will significantly impact disabled people because what it will do is that states will actually drop what is termed as optional benefits, which include HCBS, which is home and community-based services, which are the specific services that disabled people utilize to be able to live at home. And so when you talk about something like, does somebody have the bodily autonomy to choose whether they want to live or die, that's not a choice for disabled people. A lot of times you're stuck in this, as some of them said, bureaucratic nightmare of not being able to get services. And so you feel like the only choice, so that you're not feeling like a burden to your family, you're not needlessly suffering, is to choose death.
And this is the third time I've seen this film now, and I'm really moved each time by that ending where the sister is reading Elizabeth's words, and also you have that film of her, that's her family film, which I don't think anyone's ever seen before, of her at the end of her life. She's got care at home, she's going to the movies, she's reading books, and she's the one, and in that last thing where the sister's reading, the sister's reads Elizabeth's words saying, it was that bureaucratic nightmare that was always so frustrating to me. Lisa and Jen, can you actually talk a little bit more? Mia brought up the issue of eugenics. This is a moment of eugenics. People think of eugenics as some issue, some movement back in the first half of the 20th century.
This is Lisa and Jen speaking. So firstly, to put a real dollar number on the bill that was passed yesterday, that bill would cut over $800 billion, that's billion with a B, from Medicaid services. And the types of services that people depend on, which were discussed in the documentary by many of the interviewees, are services that allow people to maintain autonomy and control and dignity over their lives, to be able to be at home, to be able to participate in the community, to be able to participate in society in whatever way they choose, whether or not that is oriented around a profession or work, whether or not that is oriented around being involved or active with disability community, to be able to exercise that autonomy. Now, the question of eugenics, I've encountered this over years and years of conversations with people who really do make this assumption that if we say eugenics, we mean Nazi Germany. That eugenics came from the Nazis, that this is what fueled the anti-Semitism of the Holocaust, this is what fueled the mass murder of not just 6 million Jewish people, but also of people from Poland, of Romani people, of people who were deemed politically undesirable or asocial, who were queer, who were gender nonconforming, and those who were disabled. But the reality is that Adolf Hitler and the Third Reich were inspired by United States domestic policies. They expressed open admiration for the ways in which the United States government had pioneered eugenicist theory and practice through policies aimed at Native and Indigenous people, policies aimed at Black people, policies aimed at impoverished and disabled people, and sought to operationalize and expand and improve upon those policies and practices in Nazi Germany. And so the idea that eugenics is something from the past is not only inaccurate, but it does us a disservice when we look at what types of policies are being advanced and advocated for today. In a seminal law review article, which is perhaps not the area that you all thought I was going to go into, by the noted disability scholar Sam Bagenstos, published many years ago, he cited a whole body of psychology research that showed that across the board, when asked to estimate the perceived level of happiness and quality of life in a disabled person's life, non-disabled people always assumed that a disabled person's quality of life would be markedly decreased by the mere fact of having a disability. And that the reality showed that when people with disabilities were surveyed about their level of happiness and satisfaction and quality of their own lives, that there was only one distinct category that was identifiable in research that of disabled people who reported an overall lower quality of life. And that specific category of disabled people were those who acquired a disability later in life and only in the immediate months after first acquiring that new disability, suggesting that with time and distance from what would be a traumatizing experience, having your body-mind capacities drastically change, and to do so in a profoundly ableist society, that once you pass that moment, disabled people's perception of quality of life can vary as widely as those who do not have disabilities. But the question of eugenics looms over this body of research, right? Because if disabled people are assumed to have a lower quality of life, that to be disabled automatically means your life is tragic or suffering. Notes that, come up when I tell people that I'm autistic. I was diagnosed in childhood, and still in 2025, the most common reaction that people have to me is, I'm so sorry, right? That there's an implication in that response that it is a tragedy that I was born autistic, that my life is the tragedy. And this is true for all of us, no matter what types of disabilities we have or combinations of them that we have. And if you believe someone's life is a tragedy and is not worth living, and worse, if you believe you are a burden, that word came up, that Bouvet used that word to describe herself, I'm a burden on society, and society tells you you are a burden for existing, then the logical conclusion of that belief is these are people who should be eliminated as well as prevented from coming into existence again.
And we saw that in the film with the Michael Hickson case. This happened during COVID when there was a fear that there was going to be a shortage of care. Michael Hickson's doctors decided that he didn't have a quality of life and that they wouldn't give him the care that he needed. I wrote about the Michael Hickson case as well, and I also wrote about a woman in Oregon, Sarah McSweeney, the same thing. There was no shortage, as Melissa Hickson pointed out in your film, there was no shortage of ventilators at the time when her husband was in the hospital, but a decision was made that he didn't have a quality of life. We weren't going to extend this medical care to him. Mia, actually, can you talk, so dollars and cents keep coming up, sort of quality of life being measured by cost. Creepy Mike Wallace talks about how much Elizabeth Bouvet's care costs. Can you talk about the connection between poverty and disability?
Yeah, so we know that disabled people are much more likely to live in poverty.
By twice as much.
Yes,
Yep.
it's twice as much. And so one of the issues is that a lot of disabled people, one, are not able to get employment or face discrimination, significant discrimination while working, and have significant difficulties getting the care that they need in order to be able to work. And a lot of people have to thus subsist off of things like SSI and SSDI, which are government programs that specifically restrict individuals from earning any money or saving any money. And a lot of people survive off that in order to be able to go and get Medicaid. And that results in, because they can't pay for all of that health care costs, and work. And so this system is literally created in a way that just sort of cycles you through, where you're not able to save, you're not able to marry, because that could impact your ability to, one, get SSI or get the same amount of resources and funds.
And you mentioned SSI, Supplemental Security Income. I'll mention I did a series for NPR last year about that. SSI is this lifeline for a lot of it's intended to lift some of the poorest disabled people. It's the original guaranteed minimum income program, but it was created 50 some years ago before disabled people were expected to go to school, to work, to marry. It's built on these outdated assumptions. As Mia just said, it prevents people to get this benefit. You can't work. In fact, if you do work, you get taxed at the highest rate in America. For every $2 you make, you lose $1 of benefits. So we have these. So we do have these outmoded programs. In Reed's documentary at the end, Elizabeth talks about how she was frustrated that she couldn't work.
Right.
If she didn't have the value that people get from work.
Right.
Let me ask, we're going to take a few questions from the audience, but Reed, let me ask one last question of you.
Can I just put a dollar number on that?
Yes.
Because like we're talking around this, and not intentionally, but for those of you who are not familiar with what these limits are, to qualify for Medicaid, which is tied to the criteria for qualifying for supplemental security income, you cannot have more than $2,000 in countable assets total. That means across retirement vehicles, savings accounts, checking accounts, you cannot have more than $2,000 total. If you marry, the limit goes to $3,000. So instead of the logical $2,000 plus $2,000 for $4,000, that's what we call the marriage penalty. It's now $3,000. And those limits were last updated in 1989. Raise your hand if you were born after that. That is approximately 1/3 to 1/2 of this room.
And so, Reed, let me ask, if when you were doing the film, if Elizabeth Bouvet had been alive and you'd found her, how would that have changed your film?
Yeah, so I think I mentioned this. I think my dream would be that we interview the sisters, we get all the information from them, and then we end with Elizabeth and me being set up for an interview, and then ultimately cut to black. Because Elizabeth was this very private person, and I think, there are very relevant details that we excavated. Her admitted that the biggest obstacle she had was bureaucracy. We had no idea that she said that. So when Teresa read those words, it was like that was her thesis all along. So my dream was to kind of excavate all this information and then kind of save a private life for herself, which I think is ultimately what she wanted.
Right, she's a very private person. Well, let's take some questions from the audience. I think there's a microphone to go around. Please identify yourself and speak into the microphone. So, please.
Thank you. Ralph Winnie with the Eurasia Center. What kind of efforts is the disability community?
Is there a
We're getting a
alert
storm
going to
warning.
everyone's phones?
Okay.
Sorry, go ahead.
Okay. What kind of efforts is the disability community making with private organizations? I'm specifically thinking of the Wounded Warrior Project. Let's say I go into the military, I step on a landmine in Afghanistan, lose both of my legs. I come back, the Wounded Warrior Project will pay off my mortgage, they will redesign my house, they'll get me medical, psychological care, so I can move forward. Why aren't there more of those kind of programs outside of the military helping disabled people? Number two, what efforts are being made to stop predatory lawyers from trying to target disabled people through fraudulent conservator guardianships? I know of this personally because my mother was targeted, and I fought for over 5 years, caught up in the court system. It is absolutely horrific. So if you could answer those questions.
I mean, it comes down to dollars and cents. When you become disabled, it depends on how you become disabled. They're obviously going to treat the warrior different than the person who's driving their car truck. um, there's only so much money out there, and especially in the Western culture. I mean, it's like this public-private hot potato. One of the things, the other is taking care of disabled people, and neither are. I mean, the money just isn't there.
I would say, this is Lisa and Jen speaking, to the first part of your question, we know extensively working in the disability space that corporate philanthropy has really lagged behind in acknowledging the disability community, disabled people's projects and projects that are focused on disabled people as priorities for charitable giving, endowment, or for initiating programs that are aimed at benefiting people directly. And the exception to that is sometimes in certain types of social services. But again, as Reed said, if someone becomes disabled because of service in the US military, our country valorizes that experience of disability, even as the VA has faced consistent severe underfunding and understaffing, and resulting in the uneasy tension between the ways in which veterans who become disabled are both treated as the only kind of disabled people who should be admired, the rest of us should be pitied and cured, or are dismissed because they're holding signs made out of cardboard while sitting on the sidewalk that say they're a disabled veteran and they're begging. But I think this is a much bigger and very important conversation. To the second question that you asked, I can say, as someone who is on the board of the National Disability Rights Bar Association, we are, and many of my colleagues are people who are dedicated to advancing disabled people's rights, which includes fighting against the expansion of guardianship and conservatorship in general, not just when the guardian or conservator is fraudulent or explicitly setting out to be abusive. Because as is recognized in the United Nations Convention on the Rights of Persons with Disabilities, as well as throughout disabled activist and advocacy communities, to be placed under guardianship or conservatorship is to experience a curtailment and a denial of the exercise of any form of autonomy and self-determination. And a person needing even substantial support with medical, financial, or other decision-making does not mean that they should be deprived of the ability to have their preferences respected and to be supported in making decisions, not having decisions made for them. So I really would encourage you to please reach out to and connect with people with disabilities and allies who are fighting against guardianship.
Guardianship, that's your next film, Reed.
Got it.
Somebody, do we have another question?
Thank you. I don't really have a question. I just wanted to say a name here in this environment. That name is Frank Sarasoli. Frank was a person with a traumatic brain injury. He was my daughter's best friend in a program in San Diego, and we watched him over a period of 3 months be murdered by the healthcare system because he had an accident on the scooter that he used to get around, had a second brain injury. The three things he depended on for stability, his watch, a picture of his mom, and a tiny notebook in which he wrote down everything that happened because his memory had been obliterated in his first accident, were taken away from him and never returned. Instead, they put a sign on the wall of his hospital room that said, "Frank, you had an accident, we're here to help you." Anybody who had real experience and knowledge of brain injury would know that that was hardly sufficient. He tried to escape. He was kicked out of rehab and sent to a nursing home. He was drugged. He became more confused. He was more heavily drugged. He became more confused. I ran into the doctor in the hallway, a physician that was known to us, and said, "Please, you've got to get Frank out of here. They're going to kill him." He said to me, "Poor Frank, he doesn't have the neurons, but Frank had plenty of neurons. He had enough neurons to be embarrassed that he was in diapers in front of Esme, my daughter. The attitude of the healthcare system towards people with disabilities that they don't understand is just horrific. And I just wanted people to know his name, Frank Sarasoli.
Thank you for telling Frank's story. All right, well, any last questions? Otherwise, I'll thank you for all coming, and I hope that this life after, that you continue to talk about the ideas in this film, that you think about this, film when you think about the debate, the discussion that we're going to have over healthcare and cuts to the social safety net over the next weeks and months, and that your understanding of the debate over assisted suicide has been broadened today by this film.
And could I just thank DC Docs, the Center for American Progress, and Georgetown Disability Culture Center for allowing this to happen. And all of you, thank you for coming.
Thank you.